Quick question before we get started with the show. Do you order lab tests from companies like Dutch, DSL, Genova, or Vibrant America? Hi, I'm Dr. Carrie Jones, Head of Medical Education at Rupa Health, the absolute best place to order, manage, track, and get results from 30-plus lab companies all in one place. Practitioners using Rupa Health are saving well over 15 hours of admin time each week for their lab ordering process. With just a few clicks, you can order from 30-plus lab companies, that's over 3,000 tests, for free in one single portal. That means one invoice for all labs, paid online upfront. Plus, patients get practitioner pricing and receive full patient support through easier personalized collection instructions, automated follow-ups, super bills, answers to testing questions, and so much more. Go to rupahealth.com to sign up for your free account today. Now, let's start the show.
Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on the physicians and practitioners who are redefining medicine through their integrative, functional, and holistic approach to health and well-being. Our host for Redefining Medicine is Dr. Erica Schwartz. For more than 20 years, Dr. Erica has been at the forefront of advanced patient care, taking the best from conventional and integrative medicine and applying them to prevent disease. Dr. Erica is a distinguished A4M faculty member in disciplines ranging from hormone therapy, peptide therapy, and IV nutritional support.
Welcome to Redefining Medicine. Today, we have Dr. Elyaman. Dr. Elyaman is an internist. He's also a pediatrician. But what he does is amazing, and his life is amazing. So thank you for joining us. And first of all, I want to tell you that he has 7 children and 7 people working with him, 7 providers working with him. And he focuses on insurance-based practice, but he actually cares about the patient. So talk to me, Dr. Elyaman.
Yeah, hey, thank you for having me. I actually came from a family, I'm the oldest of 15.
Oh my God.
So at some point I realized there's no way I'm going to catch up with my mom and dad, so I stopped.
That's impressive.
Yes.
Wow.
Yeah.
Oldest of 15?
Oldest of 15.
How old is the youngest? Like 10?
No, 20.
Close enough.
Yeah.
Amazing.
Yeah, and we do primary care in Ocala, Florida. I also lecture in various areas on cardiometabolic disease because I've been in integrative and functional medicine for some time. And I keep busy.
No kidding. But tell us, because what you do is amazing. Tell us about the insurance-based model.
Yeah.
Tell us about how you provide great care and you're changing the face of medicine.
Yeah, the reason we opted to continue with insurance is that I just felt that too many people don't have access to the kind of medicine we provide because of limited resources, and they earned it. They have their insurance, so they worked hard to get it. So what we try to do is use insurance where we can, and then let them know if there are other treatments or services that insurance doesn't cover. So,
but that's really kind and caring, and it actually shows a very different side of medicine.
Yeah.
So tell me about your patients.
Yeah, we get, because I'm an internist and I'm also a pediatrician, we see them, we say, from the cradle to the golf course. So
that's nice of you to say that.
we see the whole spectrum. We have people that come in because they are interested in integrative and functional medicine and wellness, and they want that kind of treatment. We have some people that they come in just because they want a good primary care provider. You have some people that will do any type of diet or any type of anything that you tell them, and we have some people that if we can just get them to eat a serving of vegetables a day, then we're okay. And we have a philosophy that we meet people where they're at. We don't It's not like you have to do this or you're not going to be my patient. Well, you know what? One step at a time.
Amazing. Well, that's the way it should be, no?
I think so.
I think so too. Absolutely.
Yeah.
So talk to us about the talk that you're giving tomorrow.
Okay, I'm talking about non-alcoholic fatty liver disease. 1 in every 4 people have non-alcoholic fatty liver disease. It looks like it's going to be the major or the number 1 reason for liver transplant soon, surpassing alcoholic liver disease and hepatitis. And now we have technology where we can actually take a look at how bad the liver is, and we can start reversing it, and we can start seeing the reversal by blood work and by something called a fibroscan without having to do a biopsy.
Beautiful.
Yeah, and what I'm excited about is there are certain biomarkers like small density LDL that you can look at and you can track and you can see if their fatty liver disease is getting better when we put them on their integrative and functional medicine plan, and also that we can tell them how much fat is in their liver, how much hardening or fibrosis is in their liver. So we can really make a huge difference. So many people, I just had a patient a couple months ago who her previous provider told her she had fatty liver disease and just said lose weight, but didn't really get to root cause, didn't really there was nothing to watch or track or whatnot. And now that we're evaluating her and we get this fibroscan on her, she actually has cirrhosis. She might actually need liver transplant. And this is something that could have been prevented.
Right. What do you think is the root cause of non-alcoholic fatty liver?
So insulin resistance is one of the big issues because insulin resistance causes fat cells to start releasing fat and sending it to the liver as we're overloading the system. Another big cause is going to be fructose. Fructose increases uric acid.
Diet.
Yep. And a lot of people, I know there was one time where they were putting fructose as a sweetener in some functional foods. I'm glad they stopped doing that because fructose actually pushes the body to gain fat, pushes the body to create fatty liver disease. Another dehydration is actually a cause, and we also inflammation. There's an inflammatory oxidative stress process. So when we when we narrow it down to here are the root causes, we can do panels of work to take a look at all things covered by insurance. So we can see what the underlying imbalances actually are, and based on what the underlying imbalances are, we can put them on an individualized plan, and we can track and we can show them that they're getting better, which is amazing.
Beautiful.
Yeah.
Beautiful. I love it. Look forward to your talk. So tell me about other things you're involved in.
Well, apart from seeing patients in Ocala, Florida, and working with the providers and the patients there, I do work at a place called the Guest House, which is
What's that?
It's a psychological trauma center. I actually certified in trauma, in psychological trauma as well.
Amazing.
Where the philosophy is that a lot of mental health, the root is rooted in psychological trauma and traumatic events that have happened. So what we believe with functional medicine is getting to the root cause. So I will balance their chemistry while the therapists are dealing with their trauma. And hopefully for those, we have people that are in recovery that we're helping their recovery from addictive substances, but also just psychological, like depression and anxiety and other psychological ailments that we work with. So,
is it an
It's an inpatient
facility?
It is. There's an outpatient portion, but there is most of the work I do is with the inpatient facility.
I'm sure.
Quest Laboratories has their wellness division. They have Cardio IQ and Cleveland Heart Lab, and I work as a consultant with them as well to help them make this wellness more mainstream. And I speak. I was in I was in Saudi Arabia not too long ago. I went and spoke at a hospital there.
Wonderful.
Which was kind of cool. It was,
wonderful.
Yeah.
And how was that different than where we are?
They're starting to get into like a lot of the insurance managed care stuff now. Before it was kind of like they weren't as limited. It's very different. There's a lot of metabolic disease happening in the Middle East, and a lot of the foods. Because there's no alcohol in Saudi Arabia, they substitute it with juice and sugary drinks
and eating late at night.
Eating late at night. So
then,
yeah, it was a wonderful experience. Like it was great to go and see. And
that's wonderful.
Yeah.
Well, it's wonderful to learn what other people do and how to create a better, healthy world. That's the goal, right?
Oh yeah.
So you're doing all this unbelievable stuff. How did you come to the conclusion that that was the direction you wanted to take after being trained in conventional medicine?
So I started off, I think once I finished in conventional medicine and I started seeing patients, it got a little bit frustrating because, all I was doing was throwing meds at them. And a lot of times they weren't even getting better. They'd feel worse, and I'd have to say, just toughen up and take the medicine because it's, and I started speaking about internal medicine topics early on because we're in Ocala, we have a lot of the elderly population. And they kept asking me about natural medicine. And what I knew about natural medicine was there's nothing to it. It's all quackery. There's no research. Yes, snake oil. So in the beginning, and actually my wife and mother-in-law and her family really liked natural medicine. Man, I made so much fun of it. I didn't know I'd be teaching it. They'd ask patients would ask a lot of questions about supplements. So then I started looking into it, and I realized that there is research on it. It's not the way they make it seem.
And it works.
And it works.
Isn't that shocking?
Yeah.
Right.
Yeah.
So how did you make the decision? Like, this is...
So I was blessed early on with not knowing what was involved in starting a practice. Because if I knew everything involved, so I kind of just went for it early on.
Sure.
And what would happen is that I'd start learning about functional medicine, and because I'm the boss, I would just start implementing things here and there, and I slowly implemented more and more into the practice until we just said, that's it. We're Absolute Health Medical Wellness Center. We were Absolute Health Internal Medicine and Pediatrics. Back then there were phone books because we wanted to be the first in the phone book.
Interesting.
Right. Yes. Now it doesn't matter. You just pay Google, right, and you go to the top of the list. But yeah. So then we are doing business as Absolute Health Medical Wellness Center.
So in your mind, what does functional medicine mean vis-a-vis wellness, prevention, complementary medicine, all the names that we have that have only served to confuse the conventional world?
Right.
So what are your thoughts on that?
Evidence-based root cause medicine.
Sounds good to me.
Find out what the imbalance is, you rebalance the system, allow the body to heal itself. Prevention. Yes.
So why don't we just call it prevention?
We can call it prevention, but if they have a disease, we're going to figure out what the imbalance is, and we're going to work on it. But it's more
not with drugs.
Yeah, it's more upstream.
Yeah.
But then if we just call it one thing, then we're not going to have something to debate about, and we're going to have nothing to confuse patients with.
Can you imagine?
Then they'll get confused about other things, and might as well let's just leave it alone and keep renaming it.
That's what we've been doing. Yeah. But thank God for people like you, because you're changing the way medicine is practiced.
Well, thank you.
And keep up the great work. Thank you for coming.
Oh, my pleasure.
Thank you so much.
My pleasure.